I'd like to welcome you to this information session on how to submit a CLH dossier. And I'd also welcome everybody to ECHA here in Helsinki, even though it's remote. You're still very welcome. Maybe one day you get to come here. Welcome to all our participants. We have almost, I think, 450 people registered, which is delighted to see so many people interested in this. Looking at the list of names, I see many familiar names there that I know from member state competent authorities, from industry, from our stakeholders. And I'd also especially like to welcome all our participants that are from outside of the EU. We have people from the US, Canada, Japan, China, New Zealand, Nigeria. I'm sorry if I forgot anyone. And I really hope that it's the time difference isn't too difficult for you. I guess some of you are in the middle of the night or the very early morning, but I'm hoping it will be interesting for you, and thank you very much for joining. It's really nice to see so much interest in this. Before we get going into this, I first have to do some housekeeping, just to go through the things. So the next slide. The first thing to tell you all about is that we are recording this session. The information is streamed and recorded, and it will be available afterwards on the webinar website. The practicalities, and this is for good practice for all of us to work. As we're doing an information session here, we have muted all microphones, as we don't have oral questions. I'd also ask people to turn off their video. This helps the session, and the only videos that will come on when we're not sharing the slides will be for the presenters. During this session, we will not be using the hand raising function because we cannot monitor that at the same time. And comments and questions will be submitted using Slido, and the next slides will explain that. So just for good practice and politeness, please don't use the chat function for questions, as we cannot monitor that, and also refrain from using it to socialize. In case you need to reach us during the webinar, you can send an email to classification@echa.europa.eu. So Slido, if you're not familiar with it, it's very easy to use. Even I can use it, I'm a complete IT dinosaur, so everyone must be able to use it. All questions and comments will come by Slido. They'll be addressed, but some of them will be are a bit too complex, or there might be complicated answers, and we will then reply to them after the webinar. A complete set of questions and answers and the presentations will be published on the webinar page in the coming weeks. This is where you will send your questions to. This is you use the event code is #CLHdossier, or you can scan the QR code. If questions are not answered, you contact us at echa.europa.eu/contact. This slide will pop up at the end of each of the presentations so that it's a reminder there for you so that you can use it. Okay. So now I would like to move on and more formally open the session, and I ask Christelle Schillinger-Muse, our Director of Hazard Assessment, which is where the classification unit sits, ask Christelle to make some opening remarks. Christelle, good morning.
Good morning, Stella, and good morning, everyone. This is a pleasure for me to open this webinar. Initially, we thought it would be a workshop in Helsinki and we would have the opportunity to meet in person. And unfortunately, as you're all aware, because of the travel restriction, we had to revert to a webinar. And actually, I didn't know the number of people that were attending this webinar. I'm quite impressed, actually, that it has brought so much interest. For us in ECHA, and for me in particular, classification and labeling is a very important step towards risk management. When we meet third countries and we are asked on how to put a chemical management system in place, we always recommend, beside having, of course, an inventory of the chemicals on the market, starting with classification and labeling. This is efficient and this is protective. And of course, harmonized classification fits in this context. From our point of view, we have already an efficient system. We had last year an internal audit in ECHA on harmonized classification and the process, and it included the RAC committees and the opinion forming. And some of you may have been questioned by our auditors, but what I would like to stress is the outcome has been very positive, and we received very few recommendations to improve the process, and for all of them, we had already identified some improvements possibilities. But it doesn't mean that we cannot improve further, and it becomes even more important for at least two reasons. First, through the integrated regulatory strategy that we have established in ECHA, and this strategy aims at finding the most relevant regulatory instrument for every chemical that we are assessing, and also with the grouping and the screening of the chemicals that we are now doing in ECHA. And last year, we have screened close to 2,000 chemicals, which is quite impressive in terms of numbers. But it means that we are identifying even more chemicals that could deserve an harmonized classification. And these proposals are piling to some extent, and we need, all of us, to tackle them. And the second point is that, as you are well aware, I guess, is the chemical strategy for sustainability. It proposed to reinforce the place of the CLP as a central pillar. That's how I see it, actually, as a central pillar for risk management by introducing new hazard classes that we were tackling before under the REACH process. And I will come back to that in a minute. And 2 years ago, when I took over the Hazard Assessment Directorate, because I came from registration initially, I decided to visit a number of member states with competent authorities, with some heads of unit. And at that time, the visits were centered mostly on evaluation activities, because it was the time of the REACH Evaluation Joint Action Plan, for which we were discussing with the competent authorities what we could do to improve the quality of the dossier. But nevertheless, during this visit, we were gathering some feedback on CLP. We were discussing also CLP. And we were discussing what could be improved, especially in the very early stage of the process, the time of the dossier preparation, and also the accordance check that we are doing in ECHA. This is why we have decided with Stella and the CLP team to review the support that ECHA provides to the dossier submitters. And this includes reviewing the information package that describes the requirements for preparing the CLH dossier and organizing a workshop. And this is part of our 2021, this workshop or this webinar, let's say today, is part of our 2021 work program. And as mentioned before, due to the circumstances, it has become a webinar. So next slide, please. A few words on the chemical strategy and the review of CLP. And as you are aware, the Commission intends to review the CLP and plans to introduce new hazard classes and criteria, in particular for endocrine disruptors and PBT and PMT chemicals. The Commission also intends to address the neurotox, immunotox, and terrestrial endpoints. From the latest information that we are receiving from the Commission, they would rather for those endpoints go first to UN and GHS before introducing them into the CLP regulation. But now we are facing with endocrine disrupted PBT and PMT chemicals and criteria for those endpoints, and we are working, and you know that because there is the subgroup of Caracal working on the endocrine disruptors. And we have also the ED expert group that has started to discuss the PBT and PMT criteria. But overall, this review raised a number of questions on the role of CLP in risk assessment and risk management, and the one substance, one assessment concept. And for me, at least, this is far from being clear what the Commission intends to do with the CLP and what you, as competent authorities, you want to do with the CLP. But what I can see is the increasing role of CLP and consequently the increasing need to have an efficient process and a smooth cooperation between all parties. And in this context, I hope the webinar today will bring interesting discussion and proposals, as your feedback is very important to us. As regards the chemical strategy, we put a number of timelines, and you see that on the screen. But with these words, I wish you a very successful webinar, and we look forward to receiving questions. And I pass the floor to Stella. Thank you very much for your attention.
Thank you, Christelle. Thank you very much for those remarks. And I know you've got an exceedingly busy calendar today, and I thank you very much for being able to join us this morning and give those remarks to everyone. So now I will move to a brief introduction, and I can introduce myself. I'm, as you can see, Stella Jones. I'm the head of unit for classification and labeling, and I'm by training I'm a toxicologist. So in theory, I understand the science, and I will just do a few brief remarks on these three topics that I have here: the harmonized classification dossiers, how we went from workshop to webinar, and the program today. So for the CLH harmonized classification dossiers, as Christelle has already explained to you, it has a really important role in protecting human health and the environment. It's a very important tool for risk management. And Christelle has already mentioned how it's used in grouping and the different things that we do here in ECHA. And with the chemical strategy, there may be more roles for CLH. But for today, we'll just concentrate on where we are. So we have really three key phases, as we see it from the work that we do here in our unit. The first phase is about dossier submission. The second phase is about the RAC opinion development. And the third phase is its entry into Annex 6 of the CLP regulation. These three phases are like for our working phases. So today we're focusing mostly on phase 1 and the submission of dossiers. Plus we will have an insight into the RAC, or the Committee for Risk Assessment. Today is all about how dossier submitter involvement and how much we work with you and put things together leads to a smooth process. And as this improves and it gets really smooth, then this leads to good opinions. And that's really what we're here to do. So what happened to the workshop? Well, everybody knows what's happened. It is this very, very small being that stopped the world, this coronavirus. So what we did, at first we thought we would delay, like many people did around the world. Oh, it will be gone soon in a few months and everything. And then it became very apparent that we needed to rethink, because we wanted to run this session. We wanted to be able to collect the information. So we decided to change it to a remote meeting, and we had to change the format then, because what we wanted to do was to capture the information and the interactions we hoped to get from a workshop. And we came up with that we would draft a practical guide to address the challenges and obstacles that you have. We have ECHA guidance about preparing a dossier, but practical guides give you the extra help and the tips to be able to understand things and to find out how to do it. So we've prepared this document, and this is very much, we're at the beginning of the journey for this document in the first version. We've published it now on our website so everybody can see it. And we decided then to have a 3-part event to support this publication. And today is part 1. This was to organize the webinar and information session to launch the practical guide, and also to launch a survey. We decided that a survey would be how we could collect the information that we would have been able to collect if we were in a workshop. Ideally, we had hoped that the workshop would have had lots of one-to-one sessions, and there could have been lots of networking and different meetings in coffee breaks and breakout sessions. And that's very hard to actually do in a remote way. The third part of it will be to organize a webinar, which we're hoping will be sometime in the autumn, which will collect the information from the survey. And it will also, we can see where to go with the practical guide, what to do next with it. So the program today, as I said, I'm the moderator here, and we have various sessions. The practical guide session will start the program and kick it off with a Q&A session. This will be led by Chiara Perazzola. She has been the project manager here and has developed the practical guide and has pulled together the webinar that we're having today. That has been with the help of Tina Malteseur, who is organized everything, and you've seen many emails from Tina, so thank you. And we have Jerry Kuizma here also supporting. And as you all know, it's the organization is critical to everything running well, so I thank them. We also have in the practical guide Ari Karjalainen, who's our team leader in classification, and Kostas Prevadoris, who's the senior member of the environment team, to deliver the practical guide presentation. After that, we're going to pick up on a topic which is quite important about data protection and confidentiality. And we know this, it's quite challenging for everyone. And I welcome Bo Baldiuk and Valeria D'Agostini, who will do the presentation for you. We will then have a break, and we will keep to the break times. Following the break, I will welcome Till Baumer, who's the RAC chairman, and he will explain about RAC and how CLH works with this, and explain some of that, because ultimately your dossier, this is where it lands, this is where it's going to RAC for discussion and decision. And everyone wants to prepare dossiers that are successful. So you put a lot of work into preparing it, we put a lot of work into taking it through the system, and then it comes to RAC, and they want to be able to make a conclusion on it. So it's very important that these three things come together. We've then got a presentation on historical control data, which Chiara will do. We pick this out because it's quite important for some of the endpoints, and it's just to give you a flavor of what it is and why it's important. Lastly, we'll have a presentation from Pia Curious about the survey itself and what we're presenting. And later in the afternoon, I will do the conclusions and closing. So I would also like to thank just at the moment for the AV team that are supporting us and doing the Slidos. We have in another room a number of people doing the Slido questions, and they will be trying to answer as many as possible. Some of them will be selected to come into the presentations. If you don't get an answer to your question, it could well come later in the when we do the publication. So I'd like to thank the AV team, and also particularly to Matt, who's supporting us today and will help if there's any technical emergencies. And with that, I think then we can move on to the first presentation. And I hand over to Chiara to deliver the practical guide to you.
Good morning, everyone, also from me. So the practical guide. This is just a short introduction. As said before, we want to provide practical tips and advice to the dossier submitter. And it contains information from several sources, the CLH regulation, the ECHA guidance, and also the experience we gain with the accordance check process and with the RAC discussion. As a disclaimer, obviously, the CLP regulation is the only authentic legal reference, and all information in the practical guides does not constitute legal advice nor replace existing guidance. So here you see the whole schema of all the CLH process. And what we aim with this practical guide is to make these two steps, the submission and the accordance check, smoother. So the structure. We want it to be practical as possible. So we tried to follow the structure of the CLH dossier. And we have first, let's call it administrative, for lack of a better words, parts, where there is an example about how to fill the classification table, justification. And then we start with the hazard classes, physical hazard, human health, and environment. We try to group together topics which are relevant for a whole section. For example, comparison with the criteria is relevant for all hazard classes. And then it includes also reference to other documents, links, and where you can go and learn more about the subject. And you have two appendix with more practical tips. For example, the checklist, what to check before submitting, and the accordance check checklist that we discuss later on. So and a few examples from the guide. So the general topics, for example, data availability. Data availability is obviously needed for all other classes and will be discussed later on by my colleague in more details. But what I want to say is, for example, we need information for all available sources, and the dossier submitter can decide that to exclude data, but providing a justification. If you don't provide a justification, we will come back to you and ask why that data is not included. Comparison with the criteria is always relevant and present, unless the only exception are, for example, physical other classes that are, for example, you have a solid substance and a liquid, other classes not relevant. Ideally, you should compare the criteria for the category that you are proposed, for example, carcinogen in category 2, but also for the more stringent hazard class category, category 1B or 1A, and for the less stringent, for example, in this case, no classification. So this is the so-called blacklist that nobody knows about, even I didn't know about, is we just compiled this list of what we check at the accordance check. Those are the most important points. It's not exhaustive, but if you are in line with all things, your dossier is likely to pass the accordance check. Another thing that you will find in the practical guide is how to fill the classification table. The classification table has an established format in Annex 6, which means that there is a strict order and, let's call it, spelling of how to write the AT, SCL, and M factors. Let's go more in details. And the example here is for an existing entry because it has all these retain, add, modify, and remove words that you need to introduce, and sometimes they're not used correctly. So retain is when you have a reassessment of an existing classification and you confirm the exact same classification. In this case, on existing entry, there was acute chronic 3. The dossier submitter reassess it and conclude it remains acute chronic 3. Add is kind of straightforward. You assess a new hazard classes and you propose a new hazard classes to be added to the entry. Modify is a reassessment, but you change the classification. In this case, we have, for example, acute tox 4 with the asterisk in the existing handler for inhalation, and we modify it to acute tox 2 for inhalation. Please, in this case, there is also an exception, which is the acute tox 4 with the asterisks were translated from the DSD to CLP, as there's been a change in the criteria. So that's why also the acute tox 4 for oral goes under modify, even if you remain acute tox 4. But it's also explained in the guide. And last, as you have remove, when you have a reassessment of the existing classification and you decide that it's no longer valid and you want to remove it. So what is missing in this picture is the eye irritation 2 from the existing classification, which is not included in the dossier submitter proposal because they decide they don't want to reassess it. And then you don't need to put in this second row with the dossier submitter proposal. It will be automatically present in the final, in the resulting classification. And next, a couple of words about substance identity. Please, we strongly encourage you to use the register of intention. It helps for planning works, but it also help for an early discussion about the identifier of your substance, AC name, CAS number, and the substance name. And the substance name has to be consistent with the SID guide. Here you see the SID guides. And then all the name, structural formula, smile notation, etc., has to be to comply with the guide. Please watch out for isomers because individual isomers are considered as a constituent of a substance, and their individual concentration need to be taken into account. If you have more than one isomers, your substance is regarded as a multi-constituent substance, and therefore smile notification, structural formula, and everything have to comply with the fact that you have a multi-constituent substance. Also, the composition, everything has to be in line. So the EC number versus list number. EC number are all those numbers that you see, goes for start with 2, 3, 4, 5, and they are official numbers, and that's the numbers we want to see on the CLH guide. Sorry, on the CLH dossier. On the instead, the list number, those that start from 6 and above, are non-official and should not be included in your dossier. Please. Also, the test material composition is needed to assess the property of the substance, and it's important that all the information are available. And if there is anything that you want to keep confidential, just include them in the confidential annex. Physical hazards. And so I want to say that be really careful, because the 12 ATP, which entered into force in October last year, October 2020, is not yet included in the consolidated version, and it made some changes to the existing hazard classes. I listed only a few of them here. Therefore, if you want to assess one of these hazard class, you might have to check both the consolidated version and the 12 ATP. That being said, so how do we assess the physical hazards? They are based on the United Nations recommendation on the Transport Dangerous Goods Manual of Tests and Criteria. And then they depend on their physical states. See the definition in Annex 1. And generally speaking, the EU methods, a number, do not provide sufficient information to assess the physical hazard. For example, there are exceptions, and they are listed in the practical guides. For example, I'm blanking now. This method for A10 is for flammable solid. The method, the EU method A10, is the screening method is equivalent to the N1 from the EU antigen methods. So if you have a negative results there, with meaning that your substances, the result is not highly flammable, you can use that for the classification. However, if it's not the case, you have any other result that's not highly flammable, then you have to assess to go to the N1 method, because the wetted zone, the influence of the wetted zone is not included in the A10 methods. Most of the physical hazards can be assessed using the so-called screening procedure. Therefore, we highly recommend you to start with the screening procedure if you don't have data. And please bear in mind that some of the screening procedure are based on the structure formula. So you cannot say there are no data when the screening is based on the molecular structure, because at least you should know the structure of the formula. And that's all I wanted to say. I pass the word to my colleague, Ari Karjalainen.
Good morning. I'll just say a few words about the human health hazards part of the CLH dossier. So just start with a few generalities, as we might call them. By default, all effects observed are relevant to humans, and it's the non-relevance that needs to be demonstrated and needs to be justified by data. Concerning the route of exposure, generally, it can be specified when the data conclusively show no classification for the other routes of exposure, that a specific route of exposure only applies. And this, of course, results in a narrowing of the scope of the entry. And then it will then be up to RAC to actually decide whether the justification that's provided is sufficient to determine whether it is conclusively shown that the other routes of exposure don't apply. Concerning the specific concentration limits, these are part of the proposal and should ideally be evaluated each time, and the conclusion included in the CLH dossier. If SELs are not proposed, it is implicit that the generic concentration limits will be applied. RAC might consider that the data actually suggest an SCL, even if it has not been proposed. Then a few words about what constitutes a standalone report. An overview of this is provided in section 210 of the practical guide, but just a few points based on issues that we sometimes find in the CLH reports during accordance check. Information from registration dossiers and relevant and reliable key data from public sources should be used. The CAR and the DAR from the biocide processes and the pesticide processes respectively also are considered to be registration dossiers for the purpose of this compiling the CLH report. The data, the assessment should be balanced. So all data, whether they are supporting the proposal or not, should be compiled in a weight of evidence assessment, positive and negative data together. The conclusions need to be justified. So when we sometimes see references to a finding not being treatment related, this needs to be accompanied by data which enables independent verification of this statement. Then concerning the effects need to be quantified. So if a finding is considered to be increased or decreased by a particular percentage, that is very helpful, more helpful than just the statement to say that it's increased or decreased. So you need to add the percentage or the actual quantified data, the values. Additional information can be included in the annexes. It is very important that the proposal is unambiguous and consistent. We sometimes see issues where the conclusion in the classification table might be different from the conclusion in the text of the report, for example. And this can lead to some level of confusion at times. So, and can be easily avoided by perhaps an additional reading of the CLH report before submission. Clear weighting of the quality of the data is also important. This does not mean that they need to be quantitatively weighted, but it just means that a weight of evidence assessment needs to be conducted, indicating what weight is given to each piece of evidence and a conclusion then formed on this basis. Then moving on from this to a few particular issues. Some studies can provide information for more than one human health hazard class. A particular example is the specific target organ toxicity for single exposure assessment, which is based on data usually from acute toxicity studies. And this means that if you have data addressing acute toxicity, it is also useful to see whether this data could be used to form an STOT-SE assessment. Very often the data is there to form the STOT-SE assessment, so it's useful to then include it in the proposal as well. Whether it then leads to a conclusion for STOT-SE or not. For STOT-RE evaluations, so specific target organ toxicity after repeated exposure should include all the data from the repeated dose toxicity studies, and this includes the data from, for example, carcinogenicity studies. And effects on reproductive organs observed in repeated dose toxicity studies are generally evaluated under reproductive toxicity. It's not necessary to include the study results more than once in the CLH report, but instead cross-referencing is useful. However, comparison with the criteria should include an evaluation of all the data that's available. Then to move on to some specific issues that we see with specific hazard classes, and a particular one is specific target organ toxicity after single exposure, the so-called dossier, which, as you know, includes 3 categories. There's dossier 1, has dossier 2, which is assigned for non-lethal, significant and/or severe toxic effects on a specific target organ. So an assessment needs to be conducted based on the data available on whether dossier category 1 or 2 are met, or whether no classification is appropriate for these categories. But then separately from this, there is the specific target organ toxicity category 3, which covers transient effects occurring after single exposure, specifically respiratory tract irritation and narcotic effects. And these need to be addressed separately from the dossier 1, category 1 and category 2. It's worth noting that the effects observed on repeated dose toxicity studies immediately after dosing or on the first days might be of relevance for this hazard class, as well as the acute toxicity data and any specific data for specific target organ toxicity after single exposure. Moving on to a few issues relating to specific hazard classes, and I won't go through these in detail. I'll just mention that for acute toxicity, the proposal for an ATE needs to be included, or in other words, an acute toxicity estimate. For skin corrosion and irritation, it needs to be decided whether category 1A, 1B, 1C, or 1, or category 2 needs to be is appropriate, and the correct use of the data to address the criteria was also important, and this is explained in further detail in the practical guide. Same applies to the eye damage and irritation. The correct use of the data needs to be used to address the criteria as explained in the practical guide. And if data available, this should be assessed despite there being a data available addressing a skin corrosion classification. And this because it may be later on decided that the skin corrosion classification is not appropriate. And therefore, it's then possible to retain the eye damage, eye irritation classification regardless. Respiratory or skin sensitization, whether it's category 1, 1A or 1B, and consider whether the data are actually sufficient to rule out category 1A and whether therefore it should be in category 1. STOT-RE, one of the particular issues is the use of the Harbour's rule, and that's described in the CLP guidance as well as in the practical guide. With the CMRs, just very quickly a few points. Germ cell mutagenicity, this can be used for classification. The data for germ cell mutagenicity can be used for classification for germ cell mutagenicity, but it can also be used to inform on carcinogenicity classification. For carcinogenicity, there are special issues in relation to inhalation route, in particular with fibers and particles. One point to make is that in relation to fibers, there are some cases where it has been concluded by RAC that the inhalation route is the only route applicable, simply because it's not considered that the other routes can apply, even with limited information on the other routes directly. However, with non-fibrous particles, this has not been the case, and the actual data for the other routes is considered necessary to be included. Similarly, mode of action or mechanism of action data needs to be included where, for example, it's desired to show that a particular tumor type is not considered relevant for classification, or it's to indicate some lower relevance for classification, for example. Just as an example, reproductive toxicity, this classification hazard class involves 2 differentiations, development or fertility, and it needs to be considered whether the findings are relevant and meet the criteria for classification for either of these differentiations, as well as whether they might be relevant for lactation, effects on lactation, or via lactation, I should say. And then there are data relating to maternal or paternal toxicity, which need to be considered in relation to the classification as well. And then just to finish off, just a few special cases. We will not be discussing group entries here. This will be a subject of a later discussion. Supplementary hazard statement codes are sometimes useful to accompany the classifications. And when these are used, and in particular, we're talking about the hazard statement codes which begin with a 0, EUH 071, EUH 066, for example, justification is then needed in the CLH report to address these. Notes associated with classification are not included in the practical guide at this stage, but these just mentioned for completeness that these are there and may be relevant, for example, for classification of fibers. Thank you from my side, and I hand over to my colleague, Kost, to discuss the environmental classification.
Just before Costa starts talking about the environment, I just want to do a little reminder to everyone. One, to submit questions, please. We've got a team here waiting for them. But also some of the practicalities for those people who didn't perhaps hear earlier on and didn't join. Please don't use the chat function to submit questions because we are not monitoring that. We're using the Slido function. There are details of how to use the Slido on the webinar page. All microphones have been muted, and also to ask anyone, I can't see any of them on at the moment, but not to have your video running as well. And if you need to contact us, you can send an email to classification@echa.europa.eu if you have some complications. Anyway, I pass now to Kostas to continue talking about the environmental hazards and the practical guide. Thank you, Kostas.
Thank you, Stella, and good morning from my side as well. The following will be just a few slides, just assembling the experience that we have been gaining the last few years on environmental hazard classification. And the experience has been gained through CLH reports, opinion making, interactions with dossier submitters and member states, etc. And I have to say, as an introduction, a lot of the issues that you have already heard and you will read in more detail in the practical guide apply also for the environment, namely the data confidentiality, the data availability, the fact that the CLH report is standalone, the comparison with the criteria, how you fill the classification table. So all these things and data quality issues, etc., all these are common issues, also for environment. So the slides will follow a little bit the sections in the CLH report as well as the opinion document. So regarding degradation, we want information on both biotic and abiotic degradation. Usually you start with abiotic hydrolysis, photolysis, which is not as relevant for our process due to its uncertain impact relevance, and followed by biotic degradation. Consideration of the substance properties relating to the test protocol is very, very important here as well. So if you have, for example, a very volatile substance, you need to select the appropriate test protocol. We do want a conclusion on ready biodegradability because based on the decision scheme, it is very likely that it will drive the ultimate conclusion. But the more important thing, something called rapid degradability, rapid degradation, which is what CLP regulation imposes to dossier submitters to have a concrete conclusion on. We do want a conclusion at the end, a concrete, clear conclusion at the end of this respective section. Sometimes it is only done at the very end, so it is rather good if a conclusion was also earlier on in the CL's report following the template. the decision scheme is very clear in CLP. And any discussion, if this is relevant, any discussion on degradation products, the identification of them, percentage yields, how many and at what percentage are they produced, their hazard profile, this is very important also, needs to take place. Regarding now bioaccumulation, here we have seen cases where in lack of data there is no discussion, so we do really want an evaluation of all available information and a conclusion. This is very important because it is needed for chronic classification on bioaccumulation, and the information may derive from experimental studies on bioconcentration, even QSARs, low KOW, etc. Here, if a low KOW octanol water partition coefficient is to be used, experimental results are preferred over simulations, QSAR-derived, etc. Here also the relevance of the study design and protocol is important. That also refers to substance properties. For example, exposure via the one route over the other is likely to change the test results and relevance. As we said, CLP does prefer experimental BCF data. There's a clear preference stipulated in the regulation as well. And then a good quality experimental data, as I just said. So apart from an evaluation of the available information, also a clear conclusion here is needed, also to be used for chronic classification purposes. Okay. Now I have here, sorry, I had problems changing the slide. Regarding aquatic toxicity, as you know, we do want information for 3 trophic levels. Obviously, all available information needs to be included. Again, an evaluation of the appropriateness of the test protocol for the specific substance properties needs to take place. In case of difficulties, obscure substance properties or difficult to test substances, OECD test protocol 23 can be consulted. And the more comprehensive, transparent, detailed reporting is needed in these endpoints, but also all others. Analytical monitoring is of paramount importance, whether the test validity criteria have been fulfilled also, and as much information as possible, even the full study report, inclusion of the full study report, if available, would be needed, especially in cases where a specific case drives the classification. All study limitations, assumption, hypotheses, divergent from criteria need to be clearly articulated. For data-rich substances, also statistical approaches could be followed, usually in a supportive context. And all the available studies, it might be many different studies for different species of different reliability, different weights. All this information need to be assembled and discussed, evaluated in a weight of evidence basis before the proposal, the conclusion is made. And this is the last bullet is very, very important, that the evaluation is for CLP purposes. Many times we have pesticides or biocides. It's often they refer to the RAR, to EU risk assessment. This is very important point, that we want an independent evaluation for CLP purposes, as the data needs to be compared with the CLP criteria. So this needs to be evident in the CLH reports, that a new evaluation of all available information, whether it is old or new, it doesn't really matter so much. But important is that the information has been re-evaluated for CLP. If you have both EC10 values and NOEC values, EC10 values are preferred by CLP. So please record all available information, and an overall comparison with the criteria needs to take place, taking also into account not only aquatic toxicity, but also rapid degradation and bioaccumulation. Now, if there is not adequate or enough chronic data, the surrogate approach should also be used, and the most stringent outcome. This is also clearly articulated in the CLP regulation, where the most stringent outcome of the comparison of the classifications derived using chronic data and acute data needs to take place. And as we said, also difficult to test substances, very poorly water soluble. The correct protocol needs to take account, and due care needs to be taken on the correct derivation of NOx, but also reporting of results above water solubility. So there needs to be a statement explaining explicitly why this has happened and what does that mean. And the concluding slide talks about best practices and tips. This is also horizontal. This applies to everything. Kara mentioned earlier about the two appendices. So I cannot stress enough the importance of reading these two appendices very, very carefully in the practical guide. The first one refers to the checklist, what should one do before submitting a dossier. The other one about what exactly or what broadly we are checking in the ECHA Secretariat during the accordance check. And on top of that, or in combination, please do some additional homework, if we call it like this. You can consult previous RAC opinions for structurally similar substances, for example, or substances that fall within the same either chemical class or even based on uses. ECHA is here to support. We have published practical guides, guidances, templates, everything. Also, I think it is important links are included in the practical guide. The REACH guidance is also very relevant and broadly very, very similar to the CLP guidance. You can familiarize with CLH process basically in the ECHA website. You can check a little bit the different stages, timelines, etc., so that you have a better feeling of what is happening when, so that you can plan your work as well. Obviously, knowledge of the CLP regulation is a given. Coordination with the pesticidal, biocidal competent authorities of your country is also important. I'm not saying that this is not happening. It is happening, so we want to continue like this and even enhance the links. ECHA has obvious links with pesticides and EFSA, for example, but you internally in your competent authorities, you need to continue on these good collaboration practices. Support is available either internally or externally, so investigate different ways of getting this support. The earlier you get the support, the better it will be and the easier the life will be for everyone. And to end up, just a trivial comment on editorial checking. It applies to all of us. An additional editorial check at the very end is needed. Thank you for your attention, and we can slowly move towards the Q&A section now.
Thank you, Kostas. Thank you. Just before we go into the Q&A section, I'll just make some points of things that I've heard that might offer some clarification for you. There's been a reference to lots of different links. We will make sure that we have the different links added when we publish the Q&A and the presentations that will be published on the webinar website. We'll also have links there for you. Just starting, I noticed there was a reference to the Registry of Intentions. And just to say to you, as many might be thinking this, I think there's been some questions even, the Registry of Intention is not mandatory. So you do not have to fill it in before you do a CLH proposal. However, it's really useful and really informative, not just for us to know when it's coming forward, but mostly for interested parties that are interested in the substance itself. And they will see that there's an intention coming in, that there's activity. they may want to prepare documents that they would publish in the consultation. It's an important communication tool that you can use. I appreciate sometimes your own planning may not have allowed you to have time to put it on, but even if you put something on a couple of months before you submit something, it's still very useful. So I hope that clarifies a little bit for that. And the reference to it came through substance identification. If we see a substance coming in through the registry of intentions that's complex, then we can already start to look at that and help to resolve it. And it could help for your dossier when you submit it and put it in. There was references to the confidential annex. There's references to an annex to the CLH report. I've seen there's a question. I think Ari might answer it in a minute. There is some information in the practical guide on this and also the guidance. There is this confidential annex, which exists for obviously the name, the clues in the name. It's information that won't be put on our website and published, but the RAC committee will need to use this data in order to make their decisions. And when it's referred to in the opinion, it's the results are referred to without going into the confidential details. I heard that there was links to the CLP regulation itself, the consolidated version. This is all on our website. You'll be able to find it quite easily. And we also have the ATPs on there, and the 12th ATP is also available there if you need to look at it. Costas made the point, and others have, about a standalone report. One of the main reasons for having this isn't that we're being difficult and want just another template used. It's for transparency, and it's to make sure it's available for people to be able to consult and for people to be able to put in comments and see what the document holds. It may look convenient to refer to lots of databases somewhere, but if people don't have access to them, then they wouldn't be able to see what's the content of the dossier. It's also important to include all data. Negative data is important as well. We don't just want to see data that has results. Ari explained about how you need to justify how something is not relevant as well. All the information that is put together and goes to RAC, the approach that is taken, we have a weight of evidence approach on looking at the data that comes in. Studies obviously have clinician scores attached to them, some of them, but when you're putting your dossier together, you can make comments about the dossier, the studies itself. But all of that is weighed up and it's taken together. And the important thing about classification dossiers and that what RAC does is they make the decision on the data that is in front of them. To support this practical guide, there were other guidances which were referred to. There is one specifically on the preparation of dossiers, and we will look at this after this session as well and see if there are some updates needed. There is also the very big guidance document, which I think is over 600 pages, so it's not for quick reading, but that's about the application of the criteria. And that's very useful when you're looking at a particular endpoint. And some of the comments that Ari was making, you can find more information in that guidance to explain it. And lastly, just to mention that there were references to a DAR and a RAR. These are abbreviations: draft assessment report, renewal assessment report. They're used in the applications for the plant protection products, or PPP, and for biocides products, or BP. We use these terminology so much every day, we forget sometimes that people haven't heard what they all are. We will have in our next webinar looking more closely at the PPP substances in the BP and how we align those processes. There are some small sections in the practical guide on this as well. And also, if you want to look at RAC opinions, they are available on the website. You go into to the web pages for RAC, and you can search for these, and it's quite easy to find, and it is a very useful tool or very useful guide for you if it's a similar substance to see how it's put together. Okay, I think I've covered most of the things that I heard that popped up there that might be useful. We have some questions that have come in. We also have a few that were submitted earlier, and I'll hand to Chiara, who will go through a couple of these that will come up on the screen. These were ones that came in prior to the info session. Chiara, thank you.
Good morning again. And those are a collection. We rewrote them, so not exactly the same question that you sent, because some were similar. For example, there is who can submit a CLH proposal, or I am from XZ country, can I submit a dossier? So we rewrote that as, can I submit as a non-EU entity? And the answer to that question we find in CLP regulation article 37, and practically is that competent authority, manufacturer, importer, downstream user, all with the meaning of REACH as definition, REACH definition, which means that if you are a non-EU entity, you cannot submit a dossier. You can submit a dossier, I mean, if you find an EU entity that will submit it for you. And so other questions we received is who can propose a modification of an existing hazard classes, on hazard classes on an existing entry. And in the same article 37, you find the answer saying that only competent authority can, for going back to my example before, modify, retain, or remove another class. And the bottom, who can propose additional hazard classes, and that is everyone, all EU entities can add hazard classes to an existing entry. So all can use. Also last, were some questions about classification of active substances, either for plant protection product or biocide product. And we see also from the questions arriving that this CAR and DAR has an interest. And what about read-across, grouping, non-animal testing methods, how they are used in CLH. For them, they were not in scope on this info session. Therefore, we will see the existing guidance document on ECHA website. We will use some of these interest questions for the more extended talks on the second info session in in the autumn. And the last, there were some questions about endocrine disruptor. What we can say is that endocrine disruptor are not part of the CLP for the moment. Commission, as you heard before, is working on introducing new hazard classes, but they are not there yet. So we cannot answer that question. We don't know the criteria. We don't know when it will start. So yeah, that's the same.
Thank you, Chiara. And just to finish off with the endocrine disruptors, that work that we've been doing with the Commission is advancing quite well. Some of you will be aware of it if you go to what's called the Caracal meetings, that it's already moving forward. It's quite advanced. So I think if the Commission would like this legislation to be in place, I think it's next year or the year after. One other thing to say to people, if you are new at submitting dossiers or you're thinking, oh gosh, all this information and everything that's here, there is also quite a lot of information on our website just about classification. You can read through the various pages and it will explain to you about what classification is, some different aspects, the use of animal testing. It's got how you submit your dossier. It's a good place to start and it will give you good basic information before you jump into perhaps one of the guidances which are more complex. Thank you. Now I think we can move to questions. I don't know quite how this is going to happen. We don't seem to have had too many in. Have we got any questions to come up? Would appear not. I'm just, if I see some of the questions, my screen's got a certain delay. So it's coming a bit late, some of mine. There was some question I saw about, do we actually have to fill out the CLH template if it's biocides or pesticides? And yes, you do. But what we have done, there is some information on this, is that there's a joint template for the PPP. It's joint with the PPP application template and the CLH template. And this was done several years ago. and it's joined together to get all the information in. There is something in the practical guide about it. In a similar way for the biocides, the same is done. It's a joint template. And that the joint templates were developed because dossier submitters wanted this. It seemed to be, it's a better, more efficient way of producing the data. And although for us, some of the data isn't always needed for us, and for the other people, all of it isn't needed for them, but it's quite easy to go past that. And these joint templates should be used. I can't see if there's anything else in there. There's a question about weighting of data. I think I covered that a little bit. Obviously, it's important to see the quality of a study and how well it is. And that's when I said, you know, if it's a poor study or there are things wrong, it may still have information that's useful. So it's not a case of you deciding to not include it because you don't think it's got the right weighting. It's just to highlight where it is. Are there any other questions you can see there, Chiara, that we could pick up? Ari, can you explain a bit more about the annexes? As I saw a question on that. Thanks.
Yeah, just in relation to annexes, first of all, in the practical guide in section 2.2, there's an explanation of what these actually are, in particular the Annex 1. Associated with the CLH proposal. And if you go to the link, which is included in section 2.2, you'll find that there is a template for Annex 1, which also includes guidance within that template on how to fill in this annex. And this we hope will be helpful in actually compiling the annex as well as the CLH proposal itself. Stella already spoke about the confidential annexes. I'm not sure if anything further needs to be done at this stage. Thank you.
Thank you, Ari. And also to say, if you are putting a dossier in and you have put it under the registry of intentions and we're aware of it, we are open and ready to be able to support you before you put your dossier in. You just need to contact us, and we can provide support and help if you need guidance through this. I think with that, we don't have any more questions, or I haven't seen any more come up on my screen. As I say, there's a bit of a delay. So I think with that, we're a few minutes ahead, but hopefully the data protection people are ready. I think so. They're nodding at me, which is good. So I would like to move on to data protection and confidentiality and welcome Bo Baldiuk, who is our policy officer who takes care of data protection. And I'm sure many of you heard of the GDPR. And also Valeria D'Agostini, who is our legal advisor who covers this topic. I don't know which one of you is going first, but I hand over. Valeria, thank you.
Thank you very much, Stella, and good morning to everybody. So as it was mentioned, these sections foreseen some explanation about confidential information in the CLH dossier. And afterwards, we will pass to tackle the protection of personal data. As it was highlighted before, the CLH report must be a standalone document. So it must contain all the information which are considered relevant for the classification proposal. And this is why it's important that the dossier submitter, when preparing the dossier, consider that this report will be made publicly available in the view of the public consultation, and also the report will be used as the basis for the preparation of the RAC opinion. So it must contain essential information for the proposal. At the same time, the dossier must not contain confidential information. The assessment of confidentiality is under the responsibility of the dossier submitter, because it is indeed the dossier submitter the best place to consider what are the information that he put in the dossier that should be protected as confidential, because, for example, their disclosure could harm the commercial interest of the person concerned. As it was mentioned before, there is the possibility to insert confidential information in a specific separate confidential annex, and the confidential information must be clearly marked as such. At the same time, to ensure transparency, the dossier submitter must indicate specifically in the report, which will be published, which information has been put in the confidential annex. That's why we highlight that there should be a specific reference to it. In terms of the type of information that can or cannot be claimed confidential, the CLP regulation makes a specific reference to the criteria established in the REACH regulation, and in particular to the provision of Article 119 and Article 18, paragraph 2. So it's important to consider that REACH foresees, let's say, 3 types of information according to the so-called confidentiality status. First of all, the legislature foreseen the obligation of the agency to publish always certain type of information. And in relation to this type of information, there is no possibility to submit confidentiality claims. So in this case, the assessment of confidentiality is already made by the legislator. You can see here in this slide the list. I'm not going through all the specific entries, but you have it here for reference. As an example, the result of the toxicological and ecotoxicological study, but also psychochemical data concerning the substance and pathways on environmental fate cannot be claimed confidential. And you can understand the importance of this type of information in the context of the CLH proposal, of course. Then REACH foresees a second category of information, which are the information that are normally published unless there is a confidentiality claim. However, it's important to underline that under REACH is not sufficient to claim an information as confidential, but this claim must be accompanied by a justification as to why the disclosure of the information in question is potentially harmful for the commercial interest of the party concerned. And this justification must be accepted as valid by the agency. Here again, we have the list of information that can be subject to these confidentiality claims. Of course, if we talk about CLH reports, this kind of check will be made in the context of the accordance check by the agency. We have then a third category of information, which are the information which are covered by the so-called presumption of confidentiality. So there are these information that are normally deemed to undermine the commercial interest of the person concerned. Here, for example, we have the information regarding the precise tonnage of the substance, manufacturer, or place of the market. And this specific entry reflects what is normally considered as confidential under the competition law rules. Because, of course, the disclosure of the precise tonnage can give an indication of the market share of a company or its production capacity. I have a problem with the moving of the slide. Okay, sorry, there was a problem with the moving of the control remoter, but maybe my colleagues, thanks, can move to the next slide. Okay, yes, this one, the next one, please. Thank you. Okay, so in these slides, we have put some examples of information that can be inserted in the confidential annex. These concern, for example, the degree of purity of the substance, the identity of impurities and additives or the concentration range. For example, information on the composition and manufacturing process of UVCB substance. It's important to remember that if impurities and additives are claimed confidential in the dossier, so they are put in the confidential annex, the dossier submitter will need to state whether these impurities or additives contribute to the classification. So this is, of course, it's an essential information in terms of classification proposal. So thank you. This was all in relation to confidentiality. And now I will give the floor to my colleague, Bo Baldwick, which will talk about the protection of personal data.
Good morning also from my side. So my name is Bo Baldak. I am the Data Protection Officer of ECHA. And I want to say a few words also about the protection of personal data and the application of the General Data Protection Regulation, also known as the GDPR, to CLH dossiers and how that applies in ECHA. Next slide, please. First of all, I want to clarify what I mean when I speak about personal data. It is any data that can relate to an identified or identifiable natural person. So as compared to the confidential data discussed by my colleague Valeria, now we are only talking about data related to natural persons, personal data. That could be names, contact information, or any other data that can identify a natural person. So not company data, but natural persons. Next slide, please. So what is exactly the policy in terms of the protection of personal data in a CLH dossier? What we wish the dossier submitter would do in their CLH dossiers is that they would redact the names of authors of unpublished studies. So I'm focusing on the unpublished studies, not to be confused with personal data or authors of published studies. Published studies are already in the public domain. So when we speak about the redaction of unpublished studies, that goes both for vertebrate studies and for non-vertebrate studies. I just want to clarify that this is something that we have here now clarified in this session also, that it applies both to vertebrate and non-vertebrate studies, while in the past maybe this has not always been clear, and we have had several discussions with some applicants about that. So now we want to be very clear that it applies to both categories. There are also other personal data that can be redacted, but only where that would undermine the protection of the personal data of natural persons. So for instance, that could be an example, a report number or a name of a testing laboratory, if that would allow to deduce the author's name. We also want to stress that we want to make sure that the dossier submitter has already submitted to ECHA a redacted version of such a dossier, because as Valeria also said, in terms of confidentiality and personal data protection, the dossier submitter is best placed to make these redactions and ECHA can only perform a quick prima facie check on these dossiers before they get published on the ECHA website. What I want to add also here is that we are discussing with our counterparts in EFSA, in the European Food Safety Authority, to align as far as possible our policies on these aspects, as many of the files that we work on have an overlap, and we want to make sure that we have a similar or identical policy in place with regard to personal data protection and confidentiality. You may have noticed that EFSA has recently made changes to their transparency policies. They have a new transparency regulation that entered into force in April of this year, and they have made several decisions implementing those provisions. Just to stress that this is still quite new, and ECHA and EFSA are in discussions to align the policies on the personal data protection and other confidentiality matters to make sure that dossiers are treated in the same way by both public European authorities. So if there's any further changes to these policies because of that, we will inform, and we are currently looking at if there's any divergences, but at the moment we don't see them. We are trying to strive to have a similar policy between the two authorities, and we will inform via, for instance, a Caracal paper if there's any changes in this respect. But with this, I just want to repeat once more that for the personal data protection, it is most important that dossier submitters redact names of authors of unpublished studies. But with that, I would close my intervention, and I thank you for your attention.
Thank you, Bo, and thank you very much for outlining this this situation with the published and unpublished studies. It is the key thing probably in the CLH report that, or the CLH dossier you're submitting, and it's very important. And some of you will saying, oh, it looks like it's changed or it's different. For those of you who are familiar with submitting this, but Bo has explained that this is new transparency laws in EFSA, and we're very much in line with them, and we need to be aligned because, particularly if it's a PPP substance, we have a joint dossier to look at, and it's we need to have the same approach. So there will be some more communications on this, I think, in the coming months as to where we're going on this, and basically that there's data protection laws now in Europe, and we have to abide by them like everyone else does. And it's finding the right balance between data protection and open and transparency policies that we also have. It's not a case of you just hide everything because it's easier to do, because the information that is publicly available does need to be available in the dossiers. So thank you. I will now see if we have some questions come in. Chiara, we have some questions. I'll hand to Chiara now.
Yes, hi everyone. We have indeed a question from via the slide that we received on this topic, and so I'm going to read it out loud. Must references be named as a name, year in the CLH dossier when they are not given in the ECHA dissemination site and only available in the chemical safety report in the CLH, in the REACH registration, or is okay to give the name? This related to unpublished references. Okay, so it seems Bo is going to answer this question.
Well, I'm not sure if I can immediately answer this on the spot. I think I will have to have a quick look at that question in more detail. It looks like it's a very specific question, so we will look at that in detail and come back in writing. Thank you.
I can just add that the practical guide does explain a little bit about this and about how to make your studies anonymous. And we also follow that up as well. But there is information in the practical guide about how to do that. And that's quite important. There's a pattern you can use to anonymize your studies, but to still have the year available or something, which is important. Thanks.
It seems that for the moment we don't have any other question coming in from Slido. And yeah.
Okay. I think then if you do have more questions about this, to put them in, and then we will pick them up later. Obviously, it's important to get this right, as it's been explained. And it is one of the most common things we find when we have the dossiers submitted, that that people haven't seen that there are unpublished studies. And it's quite often, and sometimes they are a little difficult to see. So for the dossier submitters themselves, there may be a study that's been done by a company, and the way it's presented to you, it may look like it's published. I say then that these are key ones to always look at, is studies that have come from industry, and it mentions a laboratory or one of their own studies. It's always good to check that first, because that is often the ones that we then have to pick up when we do the accordance check. And we will send that back to you to ask you to redact that name and to anonymize it before it goes out, because that is one of the key things that BOA explained about. That's protecting a certain person in the laboratory. I think then if we've come to the end of this topic, we are a little bit ahead of time. And we were due to have a break, so I think we'll just take a longer break. And for some of us, it's lunchtime. For some of us, it's the middle of the night. Some of it, you're probably at breakfast, wherever you are. We'll take a break now, and we'll resume at what is Helsinki time, 12:15. We'll take 45 minutes. So if you're elsewhere in Central European time is then 11:15, I think. I'm looking at people to nod. I always get these times wrong. So thank you very much, everyone, and then we'll see you at 12:15. Thank you. Welcome back, everyone. I don't know whether to say good morning or good afternoon, because I think people are in all sorts of time zones, but it's good afternoon from here now in Helsinki. So just welcome you back. Just a few reminders that to use the Slido, please send questions in. We're looking forward to them. To remind not to put the questions in the chat, and that we're not using the hand raising function. I see there's a hand raise, but we're not using the hand raising function in this WebEx meeting. And with that, I will then pass on to the next presentation we have. And now this is about RAC and CLH dossiers. And I welcome Tim Bomer, the RAC chairman, to give us a presentation and talk to us about RAC. Thank you.
Thanks a lot, Stella. It's a pleasure to talk to people this afternoon in Helsinki, this morning, I think, in most of the rest of Europe. I'm just going to introduce the committee and what it does, give you a little bit about its legal basis, and then move on to some of its workload and how to approach dealing with the committee if you're a dossier submitter. Yeah. RAC is a bit unusual in that it's founded by legislation. Most EU-level committees are founded by Commission decision. So it's hardwired into the REACH legislation, and that transposes its activities across to CLP. RAC is designed to provide ECHA and the Commission with scientific advice in the form of opinions. And the opinion is a legal document mentioned in the REACH regulation. So the members are nominated by member states, but they're appointed by the ECHA Management Board in their independent capacity. And they're usually appointed after a recommendation from the Secretariat and the committee chairman to the board. RAC has no policy role. It has 4 processes at the moment, but is likely to increase the number of processes over the coming years. So under REACH, we have the authorization and the restriction titles, we have harmonized classification and labeling, and we have occupation exposure limits. We agree the majority of our opinions, I would say 95, 98% by consensus, with only occasional majority recommendations. And a majority recommendation is usually just on a show of hands rather than a vote. A vote, I think, maybe 1 in 100, something like that. It's quite a large committee. As of March this year, it had 50 members. That's increased slightly, or will increase slightly at the next management board. So it includes 2 EEA members from Norway, who are full members except without voting rights. And it has 5 co-opted members selected by committee and secretariat to fill expertise gaps that we see. In the nomination papers, the competent authority of the member state signs for 50% of the time of their nominee to the work of RAC. So each member provides about half their working time to the activities of the committee. And this is a really unusual model. It's I know of no others where this is the case. So if you take 50% of a member's time and 50 members, you get a sizable capacity there to deal with dossiers in the committee. We meet 4 times a year, so once a quarter, and total meeting time 25, 30 meeting days a year, which is quite a lot for any committee. As you're probably aware, the CLP process is managed by the ECHA classification team, my colleagues around me here, Unit C1, but the meetings and membership participation are organized by the committee secretariat. In the case of RAC, that's Unit D3, if you ever have to find us. Yeah, this is just a little delay on the slides moving, so you're tempted to click again. Talk about stakeholders and the relationship to the committee. So due to recent changes, all stakeholders are now accredited to ECHA and not to individual committees. That's just to keep the administration simple. Our meetings are not public, but they are open to stakeholders. The material, for reasons of transparency, is always discussed in open session. So we rarely ever close the session except to appoint rapporteurs, or if there's some sort of emergency that requires a closed discussion. Strict adherence to confidentiality is required while dossiers are being processed. After they've been processed and the opinion is published, then of course it's clearly not confidential. But during the process, we prefer to keep things under wraps, if you like. So members may be accompanied by advisors, and that's actually a considerable additional resource in the background for the committee to have a range of advisors with different expertise who can advise members on various dossiers that they're presented with. The committee itself may invite experts, so if we think there's something missing, we can try and find an expert who has no conflicts of interest to come and talk to us about a particular topic. And as noted in the previous slide, we have 5 co-opted members. Currently, all 5 places are filled, 2 for occupation exposure limits primarily, and 3 for authorizations primarily. But that could change as we have an open call at the moment to replace all 5 co-opted members after 3 years. At a meeting, just to give you an example, our meeting starting next Monday has something like 155 participants registered to be there over the whole 2 weeks. They're not usually there at once, but over the whole span of the week, there's a lot of people coming and going. So case owners, 2 categories. Dossier submitter is a case owner. It's your case in committee that's being dealt with. But the lead registrant or other industry representative is also a case owner in a sense, and they would be there as well. Our stakeholders are comprised of industry and civil society. They can be regular if they attend all of the time, or occasional if they just request for the odd dossier. They may bring 1 expert with them. We also have international organizations, UN occasionally, as at the moment for lead in gunshot, for example, and OECD. And then the Commission and other community bodies are represented all of the time. So it gives you an idea of how busy the place can be. We have listed on our committee page on the website a whole range of committee procedures. Just want to bring some to your attention. The rules of procedure are there quite clearly. Our rules of procedure are endorsed by the management board. So if we want to change them, we've got to go through quite a laborious process. And there's many committee procedures governing the work of RAC, which are all published there. Specific to harmonized classification and labeling is the framework for RAC opinion development. And this governs it governs the timeline of the process and how people can interact during the process. It's quite an important document and probably due for update. As from memory, I think it's from 2012. There's also a procedure for agreement seeking, which I'll deal with in a couple of minutes. That's the next slide, yeah. We call it a listing. An A list is simply a list of propositions which are agreed without plenary debate. And it's a way of getting the non-contentious stuff through committee without having to discuss it in detail and spend time on it. Well, there's a range of criteria which have to be met related to what we call adequate scrutiny of the hazard classes proposed in the case of CLH. So the dossier submitter and the rapporteurs basically have to be in alignment as to the hazard class, and the members providing written comments on the dossier need to be given notice of the intention to propose fast track, and they then need to agree to it. So when you've got all those three parties, dossier submitter, rapporteurs, commenting members in line, then you can put something on an A list without plenary debate. It's a system that has been working for, I think, the last 8 years. It's a route by which we can get things agreed with full agreement from everybody, good consultation and scrutiny, but we don't spend time in committee because the answer is clear. If it's not clear, then any member can request to take something off the A list and have it discussed. And that happens occasionally, which is probably a good thing. And then finally, when the A list has been read into the record, we agree it step by step. Just some recent changes to make you aware of. As of our March meeting this year, RAC changed its way of working to work much more through standing working groups. So to try and take the pressure off plenary by pre-discussing technical items in a standing working group of CLH. So RAC agreed to set this up at its March meeting. It's quite simple. It's almost identical to RAC. It operates under the rules of procedure of RAC. So the stakeholder participation is exactly the same. It meets ahead of every plenary by several weeks, and then the recommendations from the working group feed into plenary as to how we need to discuss things. It's open to stakeholders and dossier submitters in the same way as RAC. And it's there to provide substantial part of the necessary scrutiny of RAC opinions, discuss technical detail in particular, and come to recommendations so that RAC doesn't have to rediscuss them except in headline. It can also recommend a listing, going back to the previous slide. And the intention in time is to remove about 70% of the debating from the plenary sessions. So the working groups open up further time to discuss, and the plenary session is shortened to the most important items. So by the third working group for CLH in October, we intend to have the full agenda transposed to the new timelines, and everything will go through the working group. We're doing the same for restrictions, by the way, and we started 2 years ago with authorization. So this is not necessarily as new as it sounds. Other changes to bring to your attention. We had a complaint to the EU Ombudsman a couple of years back, and the Ombudsman made a ruling. So according to the Ombudsman's ruling, consultations intended for the public should be translated into the EU official languages and accept replies in the same languages. For us, as an English language-based organization, it's extremely difficult to manage the EU official languages, even though we're obliged to. So consultation on ECHA dossiers are seen as technical consultations, so not really intended for the public, and they're there to gather scientific information. So ECHA continues to perform these specifically technical consultations in English, while consultations genuinely intended for the general public, which there are occasionally, but not related to CLH, will be translated into EU official languages. No, it's not moving. Let me try one more time, then I'll switch over to Secretariat. No, if you could move it on for me, please. It seems to go about 5 slides and then it decides to stop. So if you go on to the next one, please. This is about, thank you. This is about track record and workload. So we've been doing harmonized classification labeling through RAC since 2010. That was really the first full year of RAC opinion making. I think we did 1 opinion that year, so it wasn't a very productive year. The next year it was 11, and the next year it was up to 35. And we ran happily along at about 35 till 2017, and then it jumped to between 50 and 60, which it's still at. So there's been a total of 620 CLH dossiers submitted. Now that figure excludes the ones that were later withdrawn. So that sort of dead capacity of dossiers, which were unfortunately withdrawn, is not included here. And those are 601 from member state competent authorities and only 19 from industry. Of that, we've adopted 447 opinions, and clearly that increases by about 12 to 15 at every meeting. So 4 times a year, another 12 to 15 gets added to that 447. So you can begin to guess when we'll hit the magic 500 sometime this year. So there's over 100 dossiers in process at any one time, and they gradually move through the system in an orderly fashion to get to committee and to be adopted. Could I have the next slide, please? And this just gives you an idea of the breakdown of the ones that are in process at the moment, where they're at. So you can see the 37 in RAC opinion development, and then the orange band with 10, those are preparing for consultation. We still have the word public in some of our slides, unfortunately. Sorry about that. And the 46 there are under review by dossier submitter for resubmission. So that's a cycle that goes back and forth. Next slide, please. Okay, this next section is on a little bit of advice on how to prepare for RAC with your dossier. Next slide, please. Thank you. So what's taken into account? I'm going to emphasize this a couple of times because I feel it's important to really grasp it. We have explicit classification criteria in the regulation. They are as crisp and precise as they could be. And where they're not crisp and precise, they're supported by extensive guidance to help you interpret them. It's probably the largest set of guidance we have in ECHA, I think, by far and away. So there's literally a huge amount of information to help you in preparing high quality dossiers. We are focused on the intrinsic hazardous properties of a chemical and not on anything else. And in RAC, as I think Ari pointed out and Stella as well, we're really stuck with the available data. With 50 to 60 dossiers a year, there is no opportunity for us to research information that is not there in the dossier. So the database is always the CLH submission, so the Annex 15 report that comes in, and what comes through the general consultation submissions. That's what we have to look at, nothing more, nothing less. We work on a weight of evidence basis. Now that's not some sort of mechanical or mathematical weight of evidence system like you can see in some bodies have tried to use. That's actually as difficult to use as it is to use expert judgment. So we give each study or piece of data a greater or lesser weighting in the body of evidence. So we may say, well, that one is extremely important. That's critical to the outcome, but those are supporting and those are less important. I'd just like to say as an aside that CLIMISH is very often seen by industry stakeholders as sort of hard and fast something as a way of dismissing studies. For us, CLIMISH is just a guide to quality. It's never a reason to dismiss a study. And if you're re-looking, for example, at something as basic as acute toxicity, you may only have 1 or 2 CLIMISH 2 studies, and the rest are all CLIMISH 3. So you've got to do something with them. So dismissing is something we try and avoid. Next slide, please. What's not taken into account? It may be obvious, but just for the sake of completeness, I'll mention it. We don't look at the risks from using the substance. We don't look at the socioeconomic aspects, and we don't take the downstream legislative consequences, especially risk management issues, into account in RAG. Such issues, if they're raised either in submissions, in position papers, or in plenary, really cannot be dealt with by RAG. And that's probably a good thing, because that's the way the process was designed and the way it's supposed to work. Next slide, please. Attending RAC discussions with a full plenary in face-to-face mode, bearing in mind we've been in remote meeting mode for the last 15 months. So we've had 4 full RAC meetings remotely. RAC can be quite a daunting place, even for experienced people who are used to public speaking, because you don't quite know who the people are. Some of them have quite authoritative voices and are very determined in what they want to say. So dossier submitters are always welcome at plenary. In the past, dossier submitters have generally participated remotely. That was always allowed. It wasn't something new that came along with the COVID pandemic. And now they can also attend working group meetings. And I think the working group meetings really are the place to get your views out rather than plenary as we go forward. You can also bring expertise if you feel you need to within limitations. But you need to be aware that the committee may ask questions, sometimes quite detailed, to clarify what's in the dossier. And if you're there yourself as the author of a dossier that's been submitted to RAC, your accompanying experts or yourself should really understand the dossier, and you should have access to the study documentation. So you need everything with you. It could be as detailed as clarifying points in the historical control data of a single carcinogenicity study, or idem dito in a repro study. So you need access to all of those kind of things in case the members ask. Interventions in general should be short and to the point. Not 3 points and then you forget what the third point was before you get to the end. Do them one by one and we'll get you back in again to do the other points you wanted. I allow members to speak first. It's their committee, but then we fit in the dossier submitters and the stakeholders at logical points into discussion so that it adds to the debate rather than becoming disjointed. Just to be aware that most proposals for harmonized classification are decided in one meeting. So there's rarely a reprise, except in a complicated case or one where we know we need time on the second meeting, but we plan it rather than allow it to happen by chance. Next slide, please. This last one I was asked by my secretariat colleagues to put in, so I did my best, but I hope it comes across. So we hope to carry out a straightforward scientific assessment of the evidence. And we hope not to have to, let's say, peel back layers of nuance in the proposal to get to the basis of it. We would like it clean and straight up, presented just on its merits with the good bits and the bad bits in it. As I said in a previous slide, the classification criteria and ECHA guidance are leading, but it's really the classification criteria. And that's where the members of RAC are expert in, is interpreting the classification criteria. You might not always agree with them, but they do it on a quarterly basis, and they might have 4, 5, or 6, even up to 10 CMR propositions in one meeting that they have to deal with. So that's where their expertise lies, and it's best not to forget that. They look at the available data, and it's your marshalling as a dossier submitter of the available data that's actually critical to our assessment. So the CLH report, that's a given, but the consultation submissions also require attention. So they need to be ordered, they need to be selected on the basis of their real relevance to the proposition, and they need to be answered by the dossier submitter in a comprehensive way in the response to comments document. I think it's good to bear in mind that there are many dossiers running in parallel. You saw that pie diagram, so you can see how many there are actually next to each other, all fighting for space on an agenda. Now, our agendas run 4 meetings ahead. So basically, I have a reasonable outline of what's on the agenda for next March. never mind this September or December. And those agendas fill up throughout the year with substances, and then we can start to focus on them through the process. But your dossier is one among many, and the clearer it is, the easier it is to handle, and the better handling it will get, because we don't have to spend time adding to it or trying to clarify it. I think the level of detail is important. You know, you need to be sure that the study summaries, particularly for key critical studies, are really adequate. Because if they're not, then we may have to request you during the process to access the original study reports. In my experience, usually industry is more than willing to provide original study reports in confidence, but we would hope not to have to go that far, that the study summaries are good enough to see us through. But it's something to bear in mind. Access to the original studies can be important. Missing data can really have a significant impact. So if you're thinking about relevant studies, think about the negative outcomes as well as the positive ones, because that balance is part of the weight of evidence. So please don't leave out negative outcomes because you think they're not interesting to the case. They are. They have a role in the weight of evidence, and they need to be there. Think about historical control data. If there are, let's say, significant tumors that need to be addressed in a CARC study, or that the teratogenicity studies have clear effects in them, but need to be interpreted as to whether they're above the background in the controls and concurrent controls or not. That's when historical data comes in within tight timelines and within the same laboratory the study was carried out as a rule. Next, please. This is my last slide, and this is a dire warning to everybody. Sorry about this, but I think it's needed. We classify in the hazard classes the categories and differentiations stipulated by CLP. So we put the endpoints in the boxes they're supposed to be in, but that's not the only possible outcome. Hazard classes which we can't evaluate, or which the data really are inclusive, are taken, it's almost by default in CLP as not classified based on Annex 6 to CLP. So if the available data can't be evaluated, or the available data is inconclusive, then the default is not classified. So that means in practice that, let's say there are 5 hazard classes open for consultation on a dossier, and for example, the repro is inconclusive for development. Then that substance will go through to Annex 6 with the 4 hazard classes that were decided. So it will look like it's been properly evaluated, but one hazard class that was quite important to that dossier will be missing. It won't show up in Annex 6 at all. There's no notation to say that this was looked at, but it couldn't be decided on. So to make it possible to see where this has happened, all we can do is in the RAC opinions to label very clearly the 2 red statements you see at the bottom of the slide there. So no classification due to inconclusive data. And that could be something as controversial as low dosing, for example, or it could be for other reasons. Or no classification in the worst case due to lack of data, and that can happen. It particularly happens with biological actives in biocides dossiers, for example, where waivers have been given in the past. Now, I know that the dossier submitter in CLP can't do anything about that, but we still have to flag it up. So those are sort of some circumstances to be aware of, and to just think when you're preparing your submission, just to make sure that it's as complete as possible so that we don't get into these type of circumstances. I mean, I have to say, I see it as a collaborative effort. ECHA has an accordance check feature in CLH. You can use that accordance check to improve the dossier. You'll get comments and recommendations back. And it's good to do your best to try and fulfill those recommendations as best as possible. Then in committee, we have a smoother ride. And in actual fact, you have a smoother ride in committee as well. I think that's my last slide, if you just check, please. Okay, so thank you very much for listening, and happy to take any questions in the Slido.
Thank you, Tim. Yes, there are some questions in the Slido for you that will come to you. But just before we do that, I'd just like to pick up about this working together. I think it is an opportunity we have to work together. And like when I said right at the very start, your dossier, its aim is to get into RAC. And if we can have the dossiers in the best shape possible and working together, then everybody wins from it. And Tim gave a nice example there where a substance could end up in Annex 6, and one of the key hazard endpoints might have got lost because there were gaps or something wasn't strong enough to get it through. And for the reader, they might think, oh, look, it doesn't have a repro classification, it must be fine, without really reading why that happened. So there's some very important messages there. And just also to flag up about the consultation and the use of the word public, which we're finding very hard to drop, because for us, when we say, oh yes, we're doing a consultation, the first thing everyone says to you, do you mean what was the public consultation, or do you mean another one? So we're trying to train ourselves not to use the word. It's a bit difficult. But this consultation happens it's 60 days for CLH dossiers, and anything that comes in during that will go onto our website as well. We publish the CLH report, and any non-confidential annexes go out on consultation. And the comments that come in that are then passed to the dossier submitter replies to them, and then that's passed to the RAC rapporteurs, and it goes into the RAC opinion. At the end, they are all published on our website as well, just to show that there is a very consistent message here about transparency and making things available. So we have some questions. Chiara will read them out to you, Tim. If you don't get it, we can go through it again. But Chiara, thank you.
Hi, everyone. So the first question is, how do you deal with confidential information in open RAC meetings?
That's a good question. It's also a tricky one. There is rarely truly confidential information in a CLH dossier. There may be, for a start, the study summaries are by definition public, otherwise you can't tell people what the study was saying. So that's clear. If you're dealing with a proprietary original study report, yes, that is confidential, and that is not published on any of our platforms. That is available to the members in confidence to review if they so choose, but that's it. It doesn't go any further than that. And our management of confidential documents is usually pretty accurate. So it's a system which is tried and trusted. Every system is subject to vulnerabilities. You know, they can break down from time to time, but so far we've been fairly lucky. I think there's a principle here as well, though, and that's that essential safety information for the protection of the public cannot really be considered as confidential. I used that let's say principle in committee when I'm trying to decide whether something really should be confidential or not. But as I said, everything is in open session, but those sessions, everybody there has signed a confidentiality agreement. So they are not allowed to leak documents to the public or elsewhere. Thanks.
The next question is a bit longer. Will the working groups be similar in nature to the Biocide Product Committee working groups, providing technical inputs prior to plenary debate? If so, who will make up the working groups? Members of the RAC with the particular expertise, or all members can participate?
Good question. The comparison to biocides is only partially correct. The intention of the RAC working groups, all three of them, is that they are process-based, not thematic. The biocides groups are thematic, so the ecotox, the human health, the efficacy would be looked at in separate working groups and then added together to get an opinion for plenary. We're working on a whole opinion in a working group going to a particular process in RAC. So it's different in that sense. So they're process-based working groups. That's deliberate. That's the choice we made after analyzing the future of RAC towards the end of last year. They're set up under the rules of procedure of RAC, so it's hardly surprising that they're almost identical in the way they're operated. So stakeholders are present in these working groups. The Commission will be present in these working groups. It feels like a mini RAC. As to the membership, the focus is on supporting the rapporteurs in their legal responsibility of reflecting the views of the community. That's what the legislation says. I read the community as being the committee as a surrogate representative of that wider community. So the rapporteurs have a legal responsibility. They sign a contract with ECHA to reflect the views of the committee. They will do that in exactly the same way, but the working group there is there to support them in their task of providing an opinion. So the working group may be tasked to help them draft, it may be tasked to examine particular questions they may have, but they are basically in the lead. So I hope that gives a flavor of how it's working. By the way, we had the first meeting a couple of weeks back, so all three working groups are already in operation.
Can you please confirm that how many people from industry can attend plenary and working group meeting? Could it be someone from regular affairs plus one toxicologist expert?
The rule for participation in RAC is the same for all ECHA bodies in actual fact. So the stakeholders are allowed to have a named representative who is there representing the organization, and they are allowed to bring one expert per agenda item with them. So let's say the dossier on substance X in CLH, they might need a human health expert, but that would be it. So that's the rule right across the board. The number of stakeholders, I think, is limited to half the number of members present, if my memory serves. We've never had that many, so the question doesn't really arise. Normally in RAC, we have 4 or 5 regular stakeholders who are there all the time, and they would have an expert accompanying them, a different one, for every dossier that they're observing. So that's a continuous coming and going of people into and out of the meeting, whether it's virtual or whether it's in person. I have to say, it's rarely an issue in CLH. Usually there's only one stakeholder with an expert or 2 stakeholders occasionally. And in a maximum I've seen there would be 3 stakeholders interested, unless you're dealing with something like glyphosate or titanium dioxide when it can multiply rapidly. But then we apply rules for intervention and we agree them beforehand with the stakeholders so that the members' right to discuss the dossier is not disturbed by too many stakeholders wanting to get in continuously. So we manage that sort of participation quite closely. I hope I've answered all the parts to that one, Chiara.
I hope so. Could no classification due to conclusive data happen? And why is that not taken up in the CLH for those endpoints?
The last part of it, I don't know. I wasn't around when Annex 6 to CLH was being developed, so I was never part of those discussions. And I suspect the whole system is a carryover from the Dangerous Substances Directive in any case, so it probably goes back all the way to 1967 when that was first implemented. Of course, you can have no classification based on conclusive data, absolutely. And generally, our opinions are quite clear on that. So it's the recent flagging up of due to inconclusive data was to fill a gap, but we were always clear on when the data was sufficient to support no classification. Thanks.
No classification due to lack of data. How is the precautionary principle applied here? No classification, will it mean that a chemical might go to the market without classification?
I'm afraid it does. It's as simple as that, but it's always been that way. And it's not something that RAC has in its mandate to start changing. This is policy. It's not a choice we make in committee or anything like that.
Precautionary principle?
The precautionary principle has a place in the committees, in all the committees. I mean, remember, we're running 4 committees and they all have to operate rather similar to similar standards. In a risk assessment, the precautionary principle is embedded into a lot of the assessment factors which cover the uncertainties. So the precaution is in actually how you deal with the uncertainties. I think it's important to recognize that we're there to advise ECHA and the Commission on scientific questions. And if we only take a precautionary line, then we're not really advising them on the science. So we have to tell it like it is. And my role as chairman is to ensure the quality and consistency of opinions. So even though I'm not technically a member of the committee, there are occasions where I have to advise the committee that they are possibly being too precautionary or that they're not being precautionary enough, depending on the case. But they have to decide it on the science. That's what the committee is there for.
And the last questions. By when will the rapporteur nominated to participate to working groups?
Sorry, could you repeat that, please?
Yeah, by when will the rapporteur be nominated to participate to the working groups?
Well, the rapporteurs are nominated continuously at the end of every meeting. So they're signed up quite far in advance. That's why we do it in confidence, because we don't want people to start lobbying them, as sometimes happens. So we keep their names quiet until they're actually submit their first draft opinion. Then, of course, it becomes clear who's the rapporteur. But we try and keep their lives as quiet as possible while we can. But they're appointed by the committee sometimes in CLH with an 18-month running time, a year in advance. So they're there all along. We would have probably, with 50 members, they could be signed up to 2 or 3 dossiers each. So, you know, we're dealing with, as you saw in the earlier slides that I presented, 100 to 150 dossiers in process.
Okay, thank you very much. I think there are some more questions coming through, but we'll answer them separately. We seem to have done well. I would just like to pick up the one about the no classification data and the precautionary principle. Of course, you know, you could say if the data is lacking, you just wallop the classification on it until it's proved otherwise. But then you're not making decisions on science. And Tim has clearly explained, you know, we make decisions on science, and that's the key role for ECHA and its committees. If there was ever that sort of approach taken, it's a policy type of decision, and it would be a certain approach. And if everything was classified, you dilute the effect of having a classification. And the important thing here is to use classification as a risk management tool to get the information for the person using the substance and on downwards into products, that they are aware of the substances that are hazardous. The key thing, of course, if you do, like we've said, if we have a dossier that's lacking data or is in poor quality and we can't conclude, everyone really loses out. And I think it's an important message to take from here. Okay, we'll move on to the next presentation, which is about historical control data. We've put this here today because it's quite an important topic. There's not enough to talk about it to have its very own workshop and a full day, but we thought it would be useful for you to hear about it and to know why we often ask about this and why it's needed. So I asked Chiara to do her presentation. Thank you.
Good afternoon, everyone, again. So the historical control data. Historical control data. So first and foremost, I would say that the concurrent control is normally the most important relevant comparator. And that's because it's the only control where you are 100% sure that the conditions are exactly the same as in your tested group, because it run in parallel at the same time with the same laboratory staff in the same laboratory. All the conditions are exactly the same. How do we use historical control data? historical data might be used to assess unexpected increase or decrease of incidence in the concurrent control. It happened. We are talking about biological systems. And it might be used to assist in the interpretation of rare tumors. And those are usually do not follow a dose dependence and have a low incidence. If that was not the case, and they are still rare tumor, we should really be scared about that substance. And overall, they should be used as an additional weight of evidence. I forgot to tell at the beginning of the presentation that all this presentation is discussing about carcinogenicity mainly, but that doesn't mean the historical control data can be applied only to carcinogenicity. They can be relevant also for other hazard classes. We all know that historical control data can vary, are influenced by several factors, among which the laboratory, the breeder, the species, the strain, the route administration, the housing condition, and plenty of other things. Just also the pathology, also naming has changed over the years. So maybe something that was labeled as an adenoma changed name after 10 years later. Then there is the so-called genetic drift. That's again, we are talking about all those animals are not perfect clone one to another, but biology changed. So those may also change the influence. Usually in this case, you see a steady change, either increase or decrease of tumor incidence over the years. However, some tumors, despite genetic drift, happen to be stable over time. What is important is that all those parameters should be considered when selecting and reporting the historical control data. That's the most important thing. So what does say the CLP guidance about historical control data? More or less what I said before, so that the historical control data provide useful information on the normal pattern or range of tumor types. Then the historical data should be used to check the validity of the concurrent control, and they can also be useful to judge biological significant or marginal increase on uncommon tumor. Moreover, and they say that the historical data should be on a case-by-case basis with important due consideration of their appropriateness and relevance. They must be from the same laboratory, strain, species, and they should be contemporary to the study that has been evaluated, and we set a period of about 5 years around the study. So what do we see in the CLH dossiers? So here I listed again all these variables that I've been speaking on the last slides. And on the left side, you will see symbols that represent what we say. Do we see they used for the validity of the concurrent control? Sometimes they are. Do we see them used for checking the increase or decrease of uncommon tumors? Yes, always. There are due consideration of appropriateness and relevance included in the CLH dossier? Almost never, and that is a bit of a problem. And yes, they are from the same strain and same species, and they are from the same laboratory. And are they contemporary to the study? Sometimes, let's say we have them, but sometimes we have also a wider interval, which again can be a problem if there is a change of incidence over the years. So a couple of examples. The first one, it will help us to understand why and how the historical data can be used to check the validity of the concurrent control and the importance of the 5-year interval, so the limited time interval. So this is a real case that we had a RAC a couple of years ago. Is about frequency of the RAC liver adenoma. And you see that you have a control group, and following that you have 3 treated groups. And it's clear from the picture that the control group is way above from the historical incidence in the other control, in the historical control data in the plus minus 5 year, the 5-year range around it. And also the historical control group incidence is above the low, the mid dose. And so the question is that what do you do with this data? Is the concurrent control behaving normally, or can we say that it's an aberrant control because it's completely outside the range of the historical control data incidence? What is going on in this sample? Should then be, despite the concurrent control be the most important correlator, should we replace it with historical control data mean? And now actually RAC and the section decide that this historical control group was an aberrant control group, anormal, and there they replace it with the median of the historical control rate and use that to compare and end up classifying in category 2 this substance. So the importance of the time interval. For that substance, we received about 30 years of data for historical control from 78 to 2011. It's like 49 studies. But as you can see here, there is a clear difference on what happened before 1991 and what happened after. The incidence, even graphically, are way above before 91 than after. So what can we see? I mean, let's look at a bit more of numbers. So the mean is almost the double, or sorry, above the double, is between the 5 years around when the study was conducted and in the full historical control data range. And the range of incidence in the 5 years is between 0 to 4 and is 3 times larger from 0 to 12 if we take into account the data for over 30 years. So what we want to stress is that this so large time interval, in this case about 30 years, are not representative of the condition at the time of the study, and they provide an inaccurate picture. So a bit more about historical control data range, but in this case within the 5 years. So this is completely fictitious study results. I made up the data, so they're completely decided on the table. And therefore you have this nice dose response relationship. You see that there's a control, the low dose, the medium, and the high dose. And then we have, for comparison, 2 sets of historical control data. Yes, it's not possible to have 2 sets of historical control data with the same relevance and reliability, because usually the study are conducted in one laboratory, therefore you can't have a second set of historical data. However, for the sake of this example, please bear with me and consider the 2 equally reliable and relevant. So in the case, both sets you have the range that goes from 10 to 40, and here you see all our data are within the range of the incidence in the historical control data 1 and 2. So should those 2 more be considered relevant for classification or not? That's a question that we need to answer. A bit of a graphical view is the same data as presented before. As you can see, the range, all our data, the control, all lie within the range of our historical control data. But let's look at the historical control data in detail. So as you can see on the left one, we have the historical control data 1, on the right side, the historical control data 2. Already visually, you see that the variability of the incidence between the 2 historical control data is quite dramatic. And in particular, you could say that the 40 on the historical control data 1 is kind of alone down there, so it's probably an outlier. While on the historical control data, yes, you have only 140, but you have others that come close. And so if you look at the table below where I included the data, you can also see this variability, increased variabilities, and if you look at the quartiles, and in particular between quartile 1 and quartile 3, you have 50% of your data. And as you see, the range of between quartile 1 and quartile 2 is quite different between the 2 historical control data. In historical control data 2, the range is much wider. So let's add our data into the picture. So the red bar, sorry for all the people who can't see red, are our study results. What can we say with that? So we have the control and the historical control data. Well, let's first of all check the concurrent control. So our control, we can say that there is no unexpected increase or decrease in our concurrent control. This value was 15, and it quite fit nicely in between the quartile 1 and quartile 3, which are between 14 and 20. So it's perfect. So, and we have the mid dose that is above this quartile 1 to 3, as is the high dose. So what can you say? In this case, the study result may justify classification. If we look instead of the historical control data too, what can we say? The control, it's possible that there was a decrease in incidence in the control because this incidence was 15 and the quartile 1 to 3 is 18 to 32. So 15 is below 18, possible decrease in there. And since the majority of the mid dose, the high dose is slightly above the quartile 3, but there's this wide variability of the historical control data. We might have doubts of if the study, if only this result could justify classification. Overall, I think myself, and I would guess also the committee, would be much more confident in classify if we have the historical control data 1 instead of having historical control data 2. But that's again is my personal opinion. I can't say anything for the committee. So in summary, what can we say about the historical control data? Yes, they do provide useful information. That goes without saying. That the concurrent control is normally the most relevant comparator. And please, do check the validity because aberrant control do happen. The historical control data must be contemporary to the study. That is, we showed that, for example, in the example, something can happen and the incidence might not be stable over the years. The historical control data range alone is not sufficient because without information about the mean, the median, it might give disproportionate weight to outliers. And we have seen that in the previous example, the historical control data 1, the data were exactly within the range, but there was one because of probably one outlier. And last, some useful references. There is Commission Regulation EU 283 from 2013 is for the pesticides, and it sets the requirement for how to include historical content data on pesticide application. Those are not mandatory for ECHA, but if you follow those instructions, it's really good parameters that we also would like to see. And last, I included this publication from Kenan et al., Best Practice for Use of Historical Control Data of Proliferated Rodent Lesion, because there are many out there, but this one was written by both industry and academia, and therefore it probably has a wider approval than any other publication. Thank you very much for your attention, and let me know if you have questions.
Thank you, Chiara. I hope that's enlightened you a little bit about historical control data and explained why it's useful and how it can be useful. I'm just seeing if we've had any questions in, but I can read this question out for Chiara so that she can digest it while I'm reading it before trying to read it and answer it. So it's a question that says, very interesting, Chiara. Oh, it's gone off the screen. Moderation, turn on. Can someone put a screen with it? Okay. Would you please indicate how the nominal 5-year period relates to the number of studies carried out at a facility in that interval, versus the rarity of incidence, i.e., for rare tumours, there could not be sufficient power to be able to assess using a 5-year only period?
Yes, that's a really interesting question. Unfortunately, I mean, a wider period range is possible. However, again, you have to demonstrate that there is no sudden change. For example, in the example that I showed before, there was a clear change before and after 91. If you had the similar pictures sending out over 30 years of study where the incidents were always more or less between 0 and 4, as they were in the last 5 years, maybe that would have been acceptable. But again, without additional information, just sending us because there are not enough studies and not enough power for these rare tumors, so we send you 50 years of background information, that's not enough for us to accept that, because the rule is more or less 5 years. But if you can justify that those 50 years are relevant because the tumor's incidence remains stable, then the 50 years may become acceptable.
So we have a second question here. Does ECHA request historical control data for AI, as in active ingredient, I take it, renewals, for studies previously peer-reviewed at initial approval, where the HCD were not requested before?
We do not require historical control data. We just think is additional information that will help to understand and to have additional information on the study. Is that, yeah. So it's not a requirement to send the historical control data.
I think the question comes a little bit where the active ingredient or active substances we call sometimes has been assessed, and then through the renewal procedure, so we're talking probably about PPP substances, things have changed and other data is available, or just an approach has changed. And I think it's taking a pragmatic approach about it. If it was going to benefit your dossier, and if you were having to resubmit the classification or look at it again, then it may well be in your interest to include that data. I think there was one other question as well. How strictly should the 5-year interval be interpreted? 2.5 years on each side of the study, or more flexible?
If your study is conducted in 2020, it might be difficult to give us historical control data of the 2.5 years after that, because other studies are not yet completed, so you don't have that data. And so in this case, the 5 years will be only before 2020. There is a slight flexibility if you don't have the data. If the study was conducted in 2000, then you have 2 years before and 2 years after. If it was conducted in 2020, you don't have the 2 years after. So there is a bit of flexibility. Of course, all goes within reasonable.
Okay, I can't see any more questions. We'll just check. That's it. Well, thank you very much for the questions, and that's been useful to add those into what Chiara has been saying. So with that, we will move on to the last presentation of this information session, and this is to launch the next part of our initiative to look at dossier submitter and to help you submit better dossiers. And this will be it's about the survey that we're going to do. And this was an idea that we came up about because we could see it as a way of collecting information. And of course, its success will very, very much depend, or completely depend, on what you send in. But I'll pass over the presentation to Pia to explain this and to give you some idea about it. And then if you do have some questions, please submit them. Thank you.
Thank you, Stella. Good afternoon, everybody. So indeed, we are about to launch a survey next month in June. And indeed, the objective of this survey is to shed more light on how to prepare good quality classification proposals, as clarity is power. Clarity is power to you as dossier submitters. It is also power to ECHA Secretariat dealing with the proposals. It is also power to the RAC members who are delivering the opinion. And eventually it is power to the Commission who eventually will transpose this information into Annex 6 in CLP regulation when it becomes a binding harmonized classification. So in all these steps, we need to have sufficient amount of clarity. So indeed, what is this survey about and why we have it right now? As it actually was already explained by Stella in the beginning of the whole session, is that since we were not able to have this face-to-face workshop in Helsinki, where we could have had more question and answer sessions and more face-to-face networking during the coffee breaks, we thought this would be a good alternative way to collect information from you to improve the submission of these classification and labeling harmonized dossiers. And in Unit C1, which deals with the classification proposals here in ECHA, we really want to understand better the tasks of the dossier submitter. And with this survey information, we really want to hear what is your current experience while you have been submitting classification dossiers, and what kind of obstacles you have come across, and if there have been obstacles, what are really the key obstacles. Also, we are very keen to hear if you have any good ideas or suggestions, for example, for additional sections in the practical guide that has been very recently published on ECHA website. All in all, we like to know what is there needed to help you in your work. Before you start answering to the survey, I recommend that you get familiar with the newly published practical guide, How to Submit a CLH Dossier, and also briefly remind yourself of the already existing more formal guidance on the preparation of dossiers for harmonized classification and labeling. Replying does not, however, mean that you have to know these guidances by heart, but it is useful that at least you remind yourself what kind of topics are covered in these guides and guidances. And after that, please tell us if there is something that is missing, but you think it would be a necessary piece of advice for you to conduct the work for the classification proposal. Or if there is something that is not clear enough and how for you to understand how to implement that piece of information in the preparation of the classification dossier. Also, we are keen to understand, does this new practical guide meet your needs? Then some flavor, what kind of questions there are in the survey. So, for example, question, do you think the practical guide provides useful advice on how to prepare a dossier? Or question, overall, did you find the practical guide understandable and easy to apply, somewhat understandable and applicable to you, difficult to understand and to apply? And also there is possibility to give a more free text information. Or then there can be a question, do you think the practical guide is missing important topics? And if you think yes, then which ones? Please fill in. And further question, do you encounter obstacles when preparing the CLH dossier? And there are examples like lack of qualified resources and time available, don't know how to use the classification report template, don't know where to find the relevant guidance, or don't know how to apply the classification criteria for the study results. Or if there are some other hindrances, then please specify. Then further question, are you or your organization aware of the importance to submit a notification to Registry of Intentions before submitting the classification dossier? Here I have to say that it is not a legal obligation to make this kind of notification, but it is very useful to make this notification because already at that stage we can together assess if this is going to be a so-called complex case or more straightforward case. It is also to tool to inform other parties that there is going to be a dossier submitter for a certain substance so that other parties will not be then working on the same substance for the same purpose to avoid duplicative work. So you heard today that ECHA is performing an accordance check to all classification proposals. So it's the first checkpoint before the actual classification process starts towards consultation at the website and then eventually to the development of the risk assessment committee opinion. And of course, in this accordance check, either the dossier passes it is successful and it can be processed further to the consultation at the website, or there is a need to make modifications and amendments because it fails the accordance check. And when we communicate back to the dossier submitter, there is a letter or a note where the major findings are recorded. And then additionally, the draft classification report dossier is sent back with track changes and comment bubbles to explain better what kind of modifications are required or recommended. And then indeed, we are very interested to understand and learn, has it been useful to you to get this kind of feedback from ECHA to modify your dossier into a good shape? And has this provided a learning also for the future one, for the future one and dossiers that you are going to prepare? So indeed, in the survey, there is a specific question that if the dossier did not pass the accordance check and it was sent back to you for your review, did you find the comments you received from ECHA clear and constructive? And if it was not clear and constructive to you, then of course we would like to hear more specifically how could we then improve the feedback given. So the survey will be launched in the beginning of June, and it will be available at ECHA webinar site, and all the participants that have been registering to this webinar will get link to this web proposal survey. Also, before answering, depending on your organization, perhaps you may also wish to talk to your colleagues to get some more internal feedback for replying. But of course, it's also possible that all the individuals separately reply to this survey. It's up to you. We estimate that responding will take approximately 15 to 30 minutes. And in addition to tick boxes, it is indeed possible to also give free text feedback. And you will have plenty of time to do this. So the survey will run for 2 to 3 months. So there is no hurry, but of course it would be nice if you could do this as soon as possible after this webinar, that it is not forgotten. So please help us to get useful information that is important to you for improving your work. So I think that preparing a classification report is a bit like going for sailing or rowing a boat. Once you start your journey, of course, you need to know where you are heading to. Then for that, it is useful to have a map, and preferably the latest up-to-date map. It's useful to have a compass. Okay, nowadays it might be even old-fashioned to have a compass, but maybe then you prefer to have a GPS. But also GPS, it's only useful if the battery is full. And thirdly, it is important to have a good communication and collaboration with your group. Without all this, steering of the boat will be cumbersome, and for sure it would take more time and energy, and in the worst case, you can get stuck in a narrow path. So let's try to get into the same rhythm where there are clear waters, and in the horizon our destiny is very clear, and rowing the boat and moving the classification report in the process becomes very smooth and swift, and we are all then rowing at the same pace. And then we continue in autumn. So so next, based on the feedback that, okay, first of all, we have received it during today in Slido, but based on the feedback from the survey, we will review all these comments and then update the practical guide accordingly if need be. Then we will also review the more formal ECHA guidance on preparation of dossiers and update and align with the practical guide, including revisions from the survey. And thirdly, we will review the ECHA classification website sections and update accordingly if there is a need. Then also in autumn, the date is not yet fixed, but we will also organize a follow-up information session where we will present the findings from the survey, where we will explain what kind of revisions there has been in the practical guide. And depending on issues that are raised in the survey, we can focus on certain additional issues in this information session. It seems likely, for example, that more explanation is needed on PPB and biocide classification proposals. And we will also present any future plans for updating ECHA guidances. So thank you. I end here.
Thank you, Pia. Thanks very much. And I'd like to say that, you know, this theme of working together to get this smooth process is quite important. And this is where very much it's your involvement that will help us to make that better. We have had an interesting question, and I know all my colleagues will smile when they hear it. Can ECHA indicate the percentage of CLH dossiers that pass the accordance check first time? I will answer the question along the lines that when this was first started, there were many dossiers that needed a lot of work done. And I've been in the classification unit for about 3 or 4 years now. And I can see that there's been a tremendous change, and it was already happening when I came. There has been workshops before, and there's been a continued improvement, and we see a huge difference in the dossiers that come in that are significantly better. However, it is hard to see all the small things, but as I check all the accordance checks that go out, I read and I see. And I have noticed that there's now many more are just small questions. They're errors really that have possibly been made, or just something's been missed. When you're doing a big document like that constantly, you almost become blind sometimes to some of the things in there. And it's quite difficult to see everything. So we don't actually rate how many have passed and failed. But what I can say is that the procedure is enormously more efficient now than it used to be. It used to take something between 18 and 20 weeks to do, and now our average time is 8 weeks. So a massive change there. The comments that we send back to people are put into 2 categories, where they're required because they're in the legislation and it won't get very far without it. And then we often put some recommendations in that there may be aspects that you could enlighten a bit more or elaborate a little bit more to make the data and the study more meaningful. So not a direct answer, but to indicate that there's it's amazingly improved this happening. And I guess the ultimate goal will be that we wouldn't have to send them back. But on the basis that we send some recommendations, they're not actually requirements. I don't know quite where we would be on actually not sending any back, because there's often something else to see with a second pair of eyes, or what we call the 4-eye approach, where more people look at things. But thank you very much, Pia. I think it's very important, this survey that we do. And some of the points that you highlighted in there, it will be quite short. It's not going to be a burden to do. And I think that one of the points that Pia made about collaborating with your colleagues, I think is really good before you put the information in. And that you've got free text in there. So it's not just the multiple choice and just quickly going through it, but if you have some messages, we would love to hear them. And it will be open for 2 to 3 months, so right through the summer, so that we can collect as much as possible. And then we'll take that forward. I haven't seen any more questions come up. There's a comment here, not a question, but a comment. Thank you. When I submitted a dossier a few years back, the accordance check was very useful, especially for reviewing how data is presented in a clear manner for evaluation by third parties during stakeholder consultation. I mean, that's great to hear that feedback. And I think that means that what we're doing is good. And I really hope that does work for a lot of people. So thank you very much for that comment. And may all of you take note of that there is useful information that comes back. It is a working together process. It's not a question us marking an exam paper of whether you've passed or failed. It's very much collaboration to keep the dossier in good shape. I think then we have come to the end of our presentations, and we've answered quite a few of the questions. So with that, I'll make some conclusions on the day as I've seen it. So what we've heard today is, well, you've heard a lot of data, a lot of information has come to you. Some of you, it will be very new. Some of you, it will be hearing what you've heard before or ratifying what you already know. The information is in this new practical guide we've published. It's got a lot of information in there, a lot of links that will help you. I think one of the overall messages has been that is to put, when we say all relevant information, that relevant becomes quite critical in that, but it's putting as much information as you can in to this to make it robust, to make it useful. You've heard about putting in negative information and negative results to include everything, and with the aim that the dossier, the classification can be concluded on. The topics that we've had today, we've picked out the ones that we know would be interesting. The data protection. I have seen there's a number of questions which we will have to come back to. They're a bit more complex to answer. It is important. The historical control data we've informed you about, so you're more aware of it. If you do need more information, ask us. And you heard about the Committee for Risk Assessment, how it's working, what it does, and why things are important for them, and how they come to their conclusions and what they're doing. And with, I think the total was, there's over, what did you say, Tim, 600 dossiers have been done. We've got over 620, 447, I think, opinions it was, which is a lot, and it's significantly faster now. I would have loved the days of one opinion a year. It could have had great holidays during that year, but it's, I have to say, it moves at a terrific pace, actually, and turning 60 dossiers, 60 opinions, and then at the same time, we're handling about another 50 dossiers coming in. So you can see there's this continual process, and that was shown in the pie chart that Tim put up about all the things that are in the process at the same time. So that the staff here in the CLP unit are dealing with dossiers at all different stages, and it's quite hard to keep hold of everything at the same time. The Slido today, Slido is quite a good function. I have used it before. We've had over, I think, somewhere around a region of about 40 questions that have come in. That's great. I think the Slido only stays open for about another 30. It's finishing now. So we will answer all of the questions that have come in, and all of them will be published in the coming weeks, along with the presentations and any links that we need to put in that will be available for you. Some of as I say, some of the questions were more complex, and we need to answer them separately. And if there's overlapping questions, we'll put them together. So what comes next? And this is really from following what Pia has said. We first of all, we'll do the post-webinar work of sorting the documents out and replying to the questions and getting all of that together. The next thing is the survey, and there we're reliant on you about submitting them. Of course, it will be open for a long time, and we all know that everybody waits to the deadline before they submit things, but please submit them a bit earlier for us. We would really like to see them quite early on, and we can get a flavour for what's coming. All the information will be reviewed, and it will provide the basis and the structure for the event that we'll run in the autumn, because from there we'll be able to see some key topics, and we can see what else to address, and to see what sort of format we have. Again, I'm quite sure we'll still be in a remote setting, and we will plan to do it like that. So it will be a WebEx meeting, and then we'll look to see how we can have the interaction from everybody. So with that, I think it's to say thank you. And I'd like to thank the Slido team that are working behind. I don't mean the ones answering the questions. I mean the people that have put this up and made sure it's running smoothly. Thank you to the AV team that have made sure we've managed today technically, even though we had a few hitches with moving the slides on. I'd like to thank all the speakers for giving their presentations, and the team answering the questions. And of course, my support team of Tina and Jerry, making sure everything works. With that, I'd like to say thank you to everyone. I wish you a very nice day, and to say goodbye. Thank you.